A court order requiring the state to maintain a comprehensive mental health system has ended. That order was put in place after a class action lawsuit was filed over the deaths of 10 people housed at the now closed Augusta Mental Health Institute in the 1980s. Governor Janet Mills' office and some other state leaders say the end of judicial oversight signals improvements in Maine's mental health system. But not everyone agrees. News Center Maine's Caroline LaCour reports.
After 34 years of court oversight over Maine's mental health services, a court master is saying case closed. Others say there is more work to be done.
One of the longest judicial oversight cases in the country, 34 years.
Mark Joyce is the managing attorney for Disability Rights Maine, one of the groups that filed the class action lawsuit against leaders of the Augusta Mental Health Institute and the Maine Department of Health and Human Services.
And instead of going to trial, the parties entered into a settlement agreement.
That agreement requiring the state not only to address problems at AMHI, but to bolster Maine's mental health systems. After past improvements and more than $260 million in investments by the Mills administration, Director of the Office of Behavioral Health, Sarah Squirrel, says the state is in a better position.
We made substantial policy and practice improvements to really support our work. So we improved our tracking system as it relates to how referrals are managed for providers.
Recent improvements include the introduction of the Maine Crisis Line and access to community-based services.
And the data really bears out the success of that. Our Maine Crisis Line answers over 10,000 calls a month. We have a 97% answer rate.
In a statement, Courtmaster and former Maine Supreme Court Chief Justice Daniel Wathen calling the changes a milestone, underscoring DHHS's dedication to accountability, elevated standards, and expanded access.
It's a floor, not a ceiling.
But Joyce says revisions of compliance standards set for the state to follow leave room for improvement.
Even though they may be above that floor, does not mean that the system in any way is functioning at the level that it should be.
Staffing Maine's mental health systems continues to pose a challenge, creating issues including limited access to services in more rural communities.
We are working towards implementing best practice programs, evidence-based programs.
Many in the mental health field say they hope the removal of the decree doesn't slow the momentum the state has gained in improving mental health care.
We still do have a long way to go.
In Portland, Caroline LaCour, News Center Maine.
Staff with Disability Rights Maine say while it chose to not challenge the state's filings of dismissal, they will continue to fight towards improving shortcomings within the state's mental health systems.